Hello again, ladies and gents. Examination of cranial nerves number 9 and 10. Number 9 glossopharyngeal, number 10 vagus. Vagus means vagrant. Vagus comes from the origin of vagrant. Vagrant means wanderer because it now wanders throughout the body. And both of these nerves originate in the middle oblongata and they both exit through the jugular foramen along with 11 and 12. So as ever, introduce yourself to the patient, explain your role, explain what it is you're going to do, gain consent, and of course not to forget confirm patient details. Wash your hands to begin with. Good afternoon, I'm Zahir Abbas and I'm your osteopath for the day. Can I confirm your full name and date of birth?
Yeah, Joe Blogs 1192.
Joe, Mr. Blogs.
Joe.
Thank you. Joe, how old are you now?
22.
Wonderful, lovely. That was good, quick maths there for you. Okay, Joe, what I'm going to do is I've been asked to examine a couple of your nerves, the cranial nerves. These are nerves which exit from the brain. Would that be okay with you?
That's fine.
What it will mean is I'm going to be looking inside your mouth. I'm going to ask you to say "ah," and I'm also going to ask you to sip a glass of water.
Okay.
Would that be okay?
Yeah, that's fine.
Lovely. Do you have any pain or discomfort?
I don't.
If you do want me to stop at any time, don't hesitate to say. Or if you're in pain or discomfort, don't hesitate, and we'll go from there. Is that okay?
Perfect, no problem.
Wonderful. Consent gained. Explain the procedure, and we'll now begin. Joe, can I just ask you to open your mouth for me, please, and give me a big ah? Wonderful, thank you. Okay, so what was I looking for? When the patient says ah, this is all to do with cranial nerve number 9, the glossopharyngeal, and the soft palate. This will raise. As this raises, we will also then look for the deviation of the uvula. There's a little dangly bit at the back of the throat, that's the uvula. And remember, the uvula will deviate contralateral to the side of lesion, as opposed to the hypoglossal, which deviates towards the side of the lesion. It's ipsilateral deviation. I've explained all of this, hypoglossal and the tongue, hypoglossal and glossopharyngeal, the uvula and the tongue deviation in a separate video. You can refer to that. Once we've done that bit, then we're going to, don't forget there's the posterior third of the tongue is innervated, the sensory aspect, because both glossopharyngeal and vagus are sensory and motor aspects. So that was a motor aspect. Then there's a sensory aspect. The posterior 1/3 of the tongue is innervated by the sensory aspect. Now, I could, if the examiner wanted me to, I would mention it, but more often than not, they'll say pass this bit. Place a little bit of salt or sugar on the posterior third of the tongue on each side. Remember to do it on each side. Okay, we'll skip that bit. And to assess number 10, you can either use a tongue depressor and push the tongue down, or you can actually touch the uvula with the tongue depressor. Now this will initiate the gag reflex. This is number 10, cranial 10, the motor aspect. Rather unpleasant, and so one of the alternative ways, one of the alternative ways to do this is ask the patient to sip a glass of a bit of water. Joe, would you mind? Thank you. Lovely. And Joe, as he was doing that without him noticing, I was actually observing the actual motion around his throat. And was there any pain or difficulty in that?
No.
Lovely. So that, again, will be dysphagia and indicative. Then we will need to explore further as to what exactly is the reason behind this. Joe, that marks the end of the examination. Do you have any questions for me at all?
I don't know.
Lovely. That's thank you. So wash your hands, thank the patient again, and that's us. I hope that helps.